I was trained as a labor economist, and I've been doing research on immigration issues for about 20 years now. I started in Australia using Australian data, Canadian data, and American data, and looking at many different dimensions, so labor market outcomes, earnings, but also social assistance receipt, unemployment, and more recently health. But moving to New Brunswick, where we have very significant challenges in terms of demography, aging population, outmigration, especially of young people, and especially from the rural areas. Front and center in the population growth division, who are responsible for population, is retention, immigrant retention. So we've been working with them very closely because what they really want to know is of the immigrants that they work so hard to attract to New Brunswick, because it's a challenge bringing people to a smaller province, what are the factors associated with them being more likely to stay? And so being able to marry my interest in research, in immigration research generally with administrative data and connection to policymakers is just a really attractive proposition. It uses secondary data. There are challenges when it comes to doing immigration research in terms of looking at retention, because certain data sets, in order to be able to see who stays in the country, where Canada doesn't have an exit, when you leave Canada, you don't have an exit interview like Australia or some other countries do, that you need to find data from somewhere. So one source is the IMDb, which is the landing records for immigrants linked to tax files. So if you cease filing tax, then they kind of assume that you've left. But the tax information is difficult to get. You have to be in Ottawa, you have to be at Statistics Canada. So what we thought about doing through our provincial research data centers, we have access to the Medicare registry. And so as part of the Medicare registry, they ask where you moved from if you moved to New Brunswick, which includes country. They ask what your immigrant status is. So we had the idea of using the Medicare registry, which is accessible in New Brunswick, to look at retention and with much more timely data. So that was the impetus to say there's some work being done on retention, but our province needs more timely information. So let's try this different kind of data set and see what kind of results we get. In terms of the what we would expect to see for, say, how do retention rates vary by country of last residence, there's some research out there that suggests that certain countries are more or less likely to have immigrants that stay. But I think what I didn't have any idea about was how the Medicare data was going to do in terms of, is this a valid way to be able to look at retention with a data set so Medicare data is when you come to New Brunswick, everyone registers for Medicare. And so that goes into the system. So we're using a data set that was never intended for tracking anybody to see how that would go. So I didn't really know what we were going to get. Well, and two things. One is that the results that we found are generally consistent with the literature. We found very big differences by country of last residence, not surprisingly, but differences in New Brunswick then for other provinces. When you look at how the relationship is between country of last residence and in New Brunswick and patterns with other provinces, there seem to be some differences there, and the magnitudes are very significant. But also very usefully and rewardingly for us is that when we compared statistics on immigration, landing records using the Medicare and the landing records from IRCC, that we had a very close, consistent series. So in addition to the results that we got about how can we help shape government policy when it comes to immigrant attraction and retention, we validated our method. Well, what's useful about we used a duration analysis, so statistical analysis where we control for other factors that are important to retention, such as age, sex, whether you live in a city or a rural area, family structure. And so through the regression analysis, we were able to control for those factors that are common to everybody and really isolate the differences that country of origin has and immigrant status. So whether you're a permanent resident or a temporary resident or a citizen. And so that allows our province, our policymakers, to target more specifically and say, well, it's not, we don't have out migration from these areas because everyone wants to move out of these areas. It's something specific to do with these particular immigrant groups. That will allow us to target, to say, okay, what is it about these groups that is making them more or less likely to leave? Because country of last residence is just a marker. It's not something it's not just that it's the country itself that's important. It's what is it about the residents from that country? What is it about their interaction with where they're moving to in New Brunswick that is making them more or less likely to stay? The people most likely to leave are immigrants from China, from Korea, from the Middle East, and from Africa. The immigrants most likely to stay, surprisingly, are Americans. New Brunswick and Maine share a border, so I think there's a lot of perhaps dual citizens. There's a category called UN, and these were immigrants who came, who didn't have an official state of last residence, but they came from conflict in Serbia in the 90s and then Iraq, Iran, and they are much more likely to stay as well. Europeans are more likely to stay, but also interestingly, unlike other countries in Asia, Filipinos seem to like New Brunswick. They are far more likely to stay in New Brunswick. So also what we found was that over time, that the more recent arrivals to New Brunswick, other things equal, are more likely to stay than earlier arrivals. So the province has invested a fair bit into retention policies, working with settlement services. So at least on the basis of our data patterns for the province, it seems to be showing some results. We can. We haven't done that piece yet, because if you leave New Brunswick for another province, the Medicare system is such that the province that you move to will notify New Brunswick that the person has left, and we will know where that comes from. So we know exactly what province they move to. If they leave the country, then we really have to wait until the Medicare registry is not renewed, and we don't know where they leave. But for inter-provincial migration, we can see that. We can also see intra-provincial migration. So for those immigrants where the province has been trying to target into the rural areas to try and shore population, how likely are they to stay in those rural areas? And what we find is they're more likely to settle in the cities, and those who don't are either moving to other cities or they're moving to cities in New Brunswick. Yeah, I like that this is a bit different for me because I've not worked so closely with policymakers before. So the research that we're doing it's not that technical, but it's interesting that it will have a clear policy implication, because our province, our population growth division, are waiting for our results to help shape and evaluate their policy. So it's really interesting as a researcher to be able to see the connection between the work that we do and what it means on the ground when it comes to the province trying to solve their demographic challenges. It is not related to the Atlantic pilot, but we are going to be working with our province to evaluate the Atlantic pilot using the same mechanism, getting data on who the Atlantic pilot participants are, linking them with Medicare data, and looking at retention.